Yes, no, you have a really good strong blood pressure at the moment. I've also noticed that your shirt collar sometimes will pulse.
Ah, interesting. Especially when I was running, like a lot for college. If I was wearing a necklace and I was just standing somewhere, my necklace would actually jump off my chest, maybe about an inch. That's no joke. My grandma came up to me and she's like, "What the hell?"
But I was also thinking, because of your sinus infection, that should go after your head as well.
Never met anyone else who has that large reverberations through their chest.
Seriously. So feel right through here, I don't have a rotation of the head whatsoever.
Correct. Now my question would be, perhaps this isn't a good question, should it rotate that way?
Oh yeah. And that's where you get caught all the time, because you don't do movements on yourself. The more and more that you do movements on yourself, okay, I might not be able to do this movement, let's say. I can have total right side spasticity. I can only maybe visualize it. But when you do the movements and work through them, like I said, even if you're only learning your limitations, you're still learning in such a way what you know is possible in other people. So like, I will never do, and I shouldn't say never, I'm sure if I trained I could do some sorts of Cirque du Soleil, right?
Sure.
They have a scapula just like I do, they have a heart chest cavity just like I do. I mean, there's technically no difference between that guy up on the trapeze versus me. I'm very fortunate that I do not have to make a living doing that. You know, to me, I look at that, I like to watch it, but that to me would be risking my life. Whereas them, it's like, they could just as easily do laundry as they could go on top of those things. And they have to think that way, because that way they don't get hurt. If they were as scared as I am, then, you know, to them it's like, woohoo! All this in a paycheck too, although they work very hard, that level of circus. But, and then also when you get hurt, now what? I've been walking up the side of a building for the past 14 months, yeah, and
I heard one of them died a couple months ago.
yeah, woman. Also, what should happen here is the lift. Just like I do it all of the time from the mastoid process when someone lays on their side. But I should be able to somehow function where your head wants to pop up. So now if I come right here to your spine, this is a great parlor trick. I'm going to come right in here and just press down. Again, I'm just asking for the spine to cooperate. So just those two little,
That's it? All you got to do is two?
not always, but again, I can use your athletics to make me look good. Look at the difference now, how the head lifts up. Do you feel a difference now with the spine?
Oh, yeah.
Yeah. Now lift your head on your own. See, look at how much activation you have.
Right. After the lower abs and middle spine.
Yeah.
I love it.
See, with me, when I first started my training, my head weighed a ton. You know, we had to do, what was it, the cam that you had to hold the head and go up towards the ceiling. I could have just lifted a bowling ball in a swing. I mean, you know, and that's when I remember being told, everything I'm telling you should be easy. If it's not easy, you're doing it incorrectly. And I'm like, okay, obviously I'm doing it incorrectly because it ain't easy. What the hell? You know? But when the head starts to lighten, you know. And see, now I'm looking for the head to rotate the back. And this would be, let's say your alarm is back here and went off. For you to go initiate the rotation from this side of your bed to behind you to the right side to turn off the alarm would be work. Do you feel it?
It's from my shoulder that it comes if I turn over that way. Yeah, I don't turn my neck backwards.
But it also because you're not feeling well. It could be lots of things. However, the way it's sort of ingrained in your system, it tells me it's been there for a while. So see how I'm very lightly going up, down, versus, I've tried doing this a couple of times, and now I'm just... But again, notice I've got you in my hands. If I take away the left, completely different movement.
Absolutely.
Not even close to being the same.
No.
Even if I held this hand still, feel the difference, the pressure on the temple versus the give of the hand, just that slight.
Absolutely.
There we go. The head's starting to go. So now what I'm going to do is very similar that I just did on the spine. I'm going to go right in here on the neck. And I'm going to apply a little bit of pressure, but not towards you, but up. And I'm just asking that neck to sway. You feel it? It's very, very simple. And again, if I don't have your head, feel the difference.
Just pinch my neck.
Yeah. There we go. See now the head's starting to roll. There we go. Now the temple's starting to get light. Feel the more of the volume of the head now. It's still jerking a little bit. That's fine. So now I'm going to come forward. Notice how it's, again, this is my fall. You'd never know it. I don't let my fingers off your back. But I'm letting the head come back down. So now here I've got the advantage of the pillow. See the pillow end so I can bring your... There we go. Now the back's coming in. I can just do this a little bit. And again, that's just my little bit of your cooperation and participation would be great. Just from that little bit. Now look at the difference. So now I actually don't like, so I'm going to ask you to lift your head up for a second because I would like the pillow to be more, I don't want it to be an issue that you're going off the edge. Feel the difference already? Which is fine. Both would have been okay. But see, I want the tension here. And I wouldn't have had as much tension with your head rolling forward.
Why do you want the tension?
Because now I want to go up and down the spine. So I'm looking at the muscles in the base of the skull. See how I'm pulling this way? I don't want it to be a pull roll because the pillow was ending.
So how would this feel different if you had rods in your neck?
Oh, good Lord. The problem with rods, and again, the rods are there. So end of my discussion. I can't work around it. I can't do anything. Their main objective was just to stop the progression of paralysis in her system, so they won. She was in great pain because of it. Again, you're going to be in pain for it. People think it's just a spinal stenosis, but you also got a right hand and left hand, or right hand, right arm, legs that are not moving. So now you're trying to lift this weight. She's a heavy woman, or I shouldn't say much heavy. She's a very large woman. Big bone, as they would say. See, now I can pick your head up so much easier. By the way, big trick. Notice how my pinky goes around the ear. This is not comfortable for anyone, going around the ear. So you want to always have the ear free if you can. But see how the head now is lifting? You have to watch you too. You don't want to dig into the temple, but see how, and I can come underneath here. So now you can feel here where the iliac crest is stopping the roll back.
Right here.
Mm-hmm. See, just you touching it, acknowledge it, look at the difference. Go ahead, come on. By the way, are you comfortable?
I am.
I can also get very nicely underneath here the C7 and actually pass these ribs in here also to participate. Notice how your head is on my arm on purpose. Again, if the arm wasn't there, feel the difference?
I gotta hold my head up a little more.
Right. So now I can come in here. Now look at the difference then. Pretty nice.
Okay.
So now I'm letting you know. I'm just gonna go in here, again, do my version of. Notice how I'm holding the knee and I'm asking for the stretch of the iliac. Because if you were still lying down, the knees would stay here and then you would start to turn through.
Right. So you want just the iliac to move, which is why you're holding it.
Well, I'm looking for the extension
Okay.
for the femur. And then I'm just going in here, so I'm just asking, what's that all about?
That's what, an infection.
Somehow, see,
Just blocks.
it's just jumping right into. So somehow the coordination with the chest, with the iliac, right there in the back is just going, yeah, lady, yeah, I don't think so. Okay. A lot like John, look at how slow I have to get just for you to stop jumping. Now see, I drop my hand down a bit, you don't have as much problem here. So that's where I'm going to use your intelligence to help me. So your brain goes, I kind of like that. That feels like a good old stretch on my lower back. Rest. Now I might even rest as far as coming back here, allowing a breath or two. Come back in here. That's much nicer. And that's where I was really impressed with that woman. Her movements were that quick. That's what I was like, you were just a chipmunk as a kid. I mean, real active woman. And I want to acknowledge it. She's been stuck in that chair for a long time staring at the paint. I mean, hopefully I said it in a way that she wasn't going home getting all depressed saying, yeah, I could climb a tree before or I can't anymore. I mean, I really try to acknowledge that. You know, she's got some great movement still in her system. Look at how much nicer that is now.
You feel like going through the iliac as well?
Oh, now it's not even in the iliac. Now I can get down to the knee and the ankles. Do you feel it? Lower back. Just so much participation. When I feel the iliac, that means there's, quote, a block there or something in there is obstructing the movement. Now it could be really interesting. Now I'm going to come in here. Here, I'm underneath your left elbow. Going across here. You're kind of big, so I don't know if I can get the clavicle, so I'm just going into the beef of the shoulder, scapula. Notice how I'm lifting the elbow. And again, notice how I'm allowing this system to stay just as it is. So what I'm doing is working on the internal rotation of the chest cavity. So now look at the difference. So now in this position, if I really wanted to go right there. See, you're so used to being bent over too. You're not used to the back in this position.
No kidding, right?
You're more used to this kind of
Yep.
situation. So since this is new, there we go. Notice how I'm activating the spine and the upper vertebrae, but I'm not forcing the head into a position. This is a really hard skill to kind of learn, although someone watching this would be like, I do that all the time, lady, but still, to actually teach this, there's a way of not holding the head and holding the head. So feel how you've got enough interesting little, between the mandible, the lower jaw, the mastoid process and all that, I can actually pull, but I need to pull in a way that I'm even with your spine.
Okay.
So I'm not digging it's really tempting to wanting to dig into finger parts into the skull. There we go. It's even getting better now. See how I'm pulling you from your tailbone?
Mm-hmm.
So just to show you differently, poking, but also when I go to poke, notice how your head kind of torques up.
Right.
And I'm just looking for that internal. So now I'm going to let you rest. I'll come back in here. So what I'm doing now is I'm pushing down on the upper ribs and I'm lifting. So I'm looking for the internal rotation. So if you were, let's say, to look up at me, the chest would rotate up and looking down. But notice how it's not just up and down, it's also then I'm going still for, I always go for that bit of a torque. So now, let's see where that leads me. Also notice too how much more I can play with your head and it's not a violation.
Mm-hmm.
Whereas at first to actually, I'll say much more, can you help me, or I have to worry about your care.
Mm-hmm.
Once again, your head's, now feel, I got your whole bum now. There you go. Now from here, if I wanted to, let's see what I can do with it. Is this okay for you?
Yep.
So feel how the leverage now of your head's changed. It's not going like this. I can just naturally pull it into place. That. Now if you can learn this and do this to me, oh, I'd pay you a lot of money.
Yes.
Real hard spot to get to on people, to getting into their upper, there we go, vestibular system. And again, notice it's just again variation. I'm not trying to correct you. I'm not trying to make you straighter. I'm just trying to show different ways of holding your head and activating the rib cage and the vertebrae.
Mm-hmm.
And if you don't think that's important, look at every special needs kids out there. Because they're holding their heads up versus it just being up in their spine. Now look at how I can lift the head.
I'll just by find a little spot in the back.
Look at your tush, your feet, back. Sorry, that was a little jerky. That's my fault. Now look. See how you even now to look here with the, now I could play with you now here. Look to the right and look to the left and look to the right and to the left and now look to the left and to the right and to the left and to the right and to the right and to the left, and relax. But what I was trying to say is look at now how much your whole spine can rotate.
True story.
Most people would be doing this, which is fine too, because you're that. Now at this point too, I can very easily, like you said, bring you back up into position from the head. Even if that was a little bit of, I can just do this, just as easy. So now with that, lie on your back for a second. I'll take this out just so you can feel it lying down. What does that feel like?
I feel like I don't feel my spine on the table like pokey at all.
Right.
That's really nice. My neck feels really light. That's really nice too.
Well, now actually look to the right and look to the left. No difference?
Oh yeah. Much easier to the right. Left, yeah, a little bit of problem.
So now, because again, you're doing this, I wouldn't, right now, normally I wouldn't do this to you, I'd just roll you over. But I'll take you up, walk around, because I think that really helps your learning. You like to compare. So now, even on this side, just feel how this shoulder is much more engaged.
Mm-hmm.
You know, even the way you hold your arms, you know, you're much more like a snuggle with the arms, and here it's like, let me hold up my body,
Yeah.
which is fine. And again, left is different from right, period, the end. But now that you're aware of what's going on, so now just feel again how I look at the rotation of the head on the pillow. Now again, see, now you asked me, should it? Well, look what I just did to you. So of course this side should do it.
Right.
You just did it. Your brain should be, now again, you know what I'm looking for, so why isn't your head just rolling in my hands? Because it's not, and that's okay. So, but that's where a lot of people would be going, you know, I think from other schools of thoughts would say, you idiot, you just did it on this side, just do it over here. Well, look at trying to teach a kid how to play basketball, you know, or run. Well, why do you do it so great this way, you know?
Right.
You're one of the freaks that can go 100 meter to the steeplechase. Most people can't even handle that much of a variation, right?
Right.
So, and this is why. But yet, when I asked you about marathons, it was like, oh, no way, you know, different mindset. Also, before I press down on the abs and stuff, so feel that lifting the head. See, this is what I was talking about before. See, now look at how pokey you are just getting my hand underneath. Even though I'm trying to lift you from here, making it nice.
Right.
But I just want to show you this. See how there's no way here I can balance the head in my hand?
Right.
Even if I do this, do you see how much strain there is?
Yeah.
So, and I'm showing you, look at that, even to take it out, you're like boom, boom, boom. So I'm also showing you this. Look at how if I go fast with the head, see? Doesn't it feel like, what, you know, you're protected.
Right.
So I just wanted to show you this. You really have to, when you find where, when, and I hear me say it all the time, saying, there you go, you know, there it is, you know. And then I know that something's just happened with the system, and now I can do 15 more things than I couldn't have done a second ago.
Mm-hmm.
Now, something I didn't do on the other side, and this side I'm going to do coming in right here, coming right underneath the jaw. What this is notice like you balancing over your pelvis when you just got up. Same kind of message. Bringing the head back. There we go. Now the back starting to release. See when you bring your head back how much you want to engage your lower back muscles to carry the head. There we go. Now feel how the tonus has changed. The reason I know that, see, feel how I can pull up through the jaw now and through the back. Now for that, people, it's awkward because people can't. When you force someone to close their mouth, God forbid, for 3 seconds, they act like they're never going to talk again. They get a little. So you usually have to tell them ahead of time you're going to work on the jaw, because otherwise it's like going to the dentist. I'm not hurting you. It's okay. And I know just based off the shoulders, before even touching with you, it's going to be harder to roll the head on this side.
Just by looking at my two shoulders.
Right. So now this shoulder is so way up. It's like Mount Rushmore. So now I'm going to come in here. Again, I'm not asking you, notice, to change your hands or anything like that. I don't care about perfect position. All I'm saying is, yeah, you can be there like this. There we go. Worry about a little bit more. Engaged, less muscles. There we go. So just from that, that's all I'm going to do, right? Now, already the difference in the shoulders, right? We can use clothing anatomy, you know, your shoulders just softer for the difference. Now I'm at a place where I can get to work.
Before you really couldn't do as much, could you?
Well, your brain couldn't decide, do I keep my head still or my shoulder still? So I try to take the shoulder out of the picture. So now in this case, notice what I'm doing is I have your temple in my hand and I'm here. So I'm actually asking my left hand to be the stationary point, and this side I'm sort of moving the temple around. Yes, I'm moving my left hand to go with it. So I'm pushing in as you're going forward and back, but I'm moving the temple around a little bit and using the Left hand is the counter.
Moving the temple using the frontal bone. Front.
Right.
'Cause your fingers aren't on the temple. There's some-
Sorry, but I can also do this. I can palm heel it. And see, I can get the fine skills in there. The whole front of the crane.
Oh,
There we go.
wow. Totally.
And now,
You can feel that on all the sutras.
oh yeah. And also look at the relationship you're getting to C1. There we go. That's much nicer. I can come back in again. Fine tune it. There we go. Now feel the extension through the head. Feel how the top of the head extends down
Mm-hmm.
and come back up. And then there you go. There's your acceleration and everything. I can come back here at the top of the head. And you notice how I'm working on you at a really different angle. Most people would think working with the head dead on, mass at center. You know, lying down, nose to ceiling.
And you don't often work on the head from this position, do you?
Oh, yes and no, it depends. Again, if you're in here for maintenance, I've got enough other things to worry about. But look at the difference of just doing this. See now, look at how I can slide under the head. If anything, I'm just gonna catch your hair a little bit, sorry. But see how much easier? Look at how much now the head can turn. So do you think driving, riding your bicycle, running will be, so look at how much different now. Look at your peripheral. See now, because your back's different, look at how you can go up and over the back.
Absolutely.
So now look to the left, and look to the right, and look to the left. There you go. And to the right, and to the left, and now to the left, and to the right, and to the left, and to the right, and to the left, and to the left, and to the right, and relax.
It's crazy to me that other guy was so locked with that group.
Yeah, but that's something, again, he's had for a long time. Now look at how I can spin C7. There we go. And again, I'm doing a very different lesson on this side, except for this part I will do the same. So now, I'm going to ask you now to lift your head up and put it back down. So notice how you literally have to lift your shoulder first to pull your head up.
Yeah.
So do it again. See that?
Yeah.
Okay, so now this time, I'm going to do just a couple of in. There you go, I let your breath. And then I just come back out with your breath. For some people, it's not that clear. Some people hyperventilate. You know, you have to go. I look at the rhythm of the water coming up in an ocean or back out again. Just that nice, soft. So now lift your head up. And back down. And again. And again. And then without me. Feel the difference now?
I'm using my pelvis and spine.
Yeah.
It's my shoulder.
Now again, just look at how much nicer I can get my hand underneath your head. Now look at how.
Hmm.
There we go. On the spine. And again, we can go into the spinal stenosis and all of this. So to actually bring the spine out to this position, correct?
Mm-hmm.
Now I'm letting you breathe. You've never held your head in this position. And that's okay. This is something too a tall person needs quite regularly, especially as you age. you look down too much at other people, it's just natural, and it's just that as the body compresses. Osteoporosis, there's lots of things too. So now I can come under here, look at how I can balance your head. See how I'm lightly pulling on the neck? And the reason, again, this is so advanced is just to have the fine motor skills in the right hand and the left in this position. Without the head suddenly, oops, oh, I'm sorry, you know.
Mm-hmm.
That's another thing. You might see me screw up, but I never say oops or I'm sorry again unless I'm touching breast tissue by accident. There we go. That was nice. Notice too how you can look down from up here versus looking down from here. Feel the roundness difference?
So what are you working on with your left hand right now?
So what I'm working on is I'm actually pulling your head back. There we go, and I'm letting the spine bend from this position. So I'm trying to activate this area of the spine.
Mm-hmm. Because it's not activated?
Well, so without moving your head, look up and look down. And look up and look down. And look up and look down. And up and down and relax. Feel that line down. But do you feel that the spine is more, erect, or however you want to look at it? But the spine should be able to bend backwards from here. If I asked you to do a back bend.
What's funny is that you're like doing things in my upper spine, and I really can't feel what you're doing in my upper spine.
Oh, just because you don't use it that much.
Right. That's what I think I'm doing that.
There we go. So now I'm here, right below C7. I'm into the knee of the shoulder. Now again, would I do something like this in a little kid? Probably not, but now watch. I can totally pick you up.
Yeah, you could.
See? And the head's just okay with that
Mm-hmm.
because the neck muscles are starting to change. So now I can go in here. Sorry, that wasn't smooth. I do apologize once in a while. Now look at how I can turn your head around. Can almost screw the thing off. So now I'm going to come underneath here, my hand underneath your arm underneath your head. Notice too, again, the balance of the head. See how as I pull and go up and down, your head's just, yeah, whatever, lady. I'm not worried about because your head's floating in my hand. So I can even do something like this, and like this, and like this. I can pull, I can push. Most people, like I said, that come in originally with the stiff necks, and that's why they're definitely afraid of chiropractics, because they're just afraid that someone's just going to take their head and yank.
Mm-hmm.
So I'm going to come back in here. And again, if I just push down on the neck, you're just going to get, it's just like my thumb's just touching you. A little lift. And that's the part where, there we go, you were able to just go take your head to the shoulder because the neck could sway. See, now I can apply a little pressure, bringing the head back. And see, now I can push down, almost going forward. You feel that?
Mm-hmm.
So there's a twist in the neck. But look at how your pelvis reacted. Do you feel that?
Mm-hmm.
Again, it's no difference in putting a crust on a pie. It's a very gentle, and there we go again, that twist. Again, palm heel just right across the forehead. And come underneath your elbow just to work on that twist a little bit. Overcome. There we go. Just separating the head from the shoulders. Feel the difference?
Mm-hmm.
Notice how I can now lift up the head. I'm going to do that again and twist automatically. Goes right into almost dead center ceiling. And now that your neck is freeing up, there we go. Now I can get into the fine tuning. So notice here I can lift just fine, coming forward right here. There we go. This is where you do the fine tuning work. You start bringing the head in all these little crazy ways. Now I can go back to just right here, and I can do all these fine tunes. Look at your shoulder now, don't you? Big difference. Honestly, your shoulder's so relaxed. If I just still it, the camera, now you can see the whole pulse. Your pulse through the shoulders. You see that?
Mm-hmm.
Yeah. Your shoulder's literally going boom,
Gosh, I really do have a pulse. That's crazy. That's just nuts.
But that's that. Okay, there's that fluidity chapter. So from this lesson, you write that.
Dude, alright, cool. I could never work for Mission Impossible. I'd set off all the motion sensors or just my heartbeat. That's ridiculous.
Oh, you just couldn't play cards well either. So now I'll take you up again, walk around, and then I'll take you back on your back when you're ready. Now that I have all that done, I can do more in this position. So now feel from here, see, lifted the head's just fine. See, pulling the bolsters just fine.
Mm-hmm.
Now from that conversation, if I wanted to, wasn't planning on it, but I can at least go down. Look at how easy I can get under the back.
Mm-hmm.
And notice how there's a big difference between just one hand down
Mm-hmm.
or hold the head.
Totally.
So just that slight pull. Now I'm just going in, riding the spine, coming up. Again, pulling on the head a little bit. See, I know that right from the beginning, so I can adjust where my fingers go underneath.
Little pop.
Great. There we go. What?
So you keep doing it.
Now that's a C7. Look at how nice I can lift you. This is what takes all the tension off the upper spine.
So lift the C7.
Yeah. Well, because I'm getting an arch in this area. Most people bend back, C7, you can really see it in me, and that's where they round towards the back.
Mm-hmm.
I can just go here on this. See, this is where, when I work on people, I know it's possible. Look at that, your head's floating. Now, if your eyes close, look to the right, to the left, to the right, to the left, to the right, to the left,
What do you do with the eyes closed?
This visual stimulation. You learn quicker. I mean, you have to learn with the visual stimulation. That's the one thing I disagree with, like with autism stuff. Everything should be, no toys, no stimuli. Well, that's the real world. What the hell is a car? A car is a giant toy. You're taking a kid out. That's just what life is. Or to say a child can't do any other therapy. Well, that means you can't lift your child into a car seat. You can't, where do you draw the line? Balance is balance. Here, I'm just fine-tuning the weight of the head. But also notice, look at how nicely now I can bend your neck. Notice how there's no concerns whatsoever from you. Again, I'm just fine tuning it. I'm still finding out those couple of spots. And you're just used to looking down, so you've just developed a lot of muscles right in here in the back of the skull to hold your head up. Mm-hmm. So when I go in that position, they're engaging because that's what they do. Mm-hmm. I look down like that, I'm going to engage. So what I'm doing is showing you how to look down, in a sense. There we go. See now, I've got your head in my hands, right? Mm-hmm. So I'm just sitting there. So now look down and look up and down and look up and down and up and up, down and up and down and up and relax. See, now if that was an issue for you or not becoming smoothly, I would feel any of those eye muscles starting to tighten throughout your head. And that's why I work with you and hold your head and do all these things. And you can see where that was I shouldn't say fail, but with Scott, where it was difficult.
Oh, yeah.
Look at that now. Now, so now I can push in. Notice too, I can apply a lot of pressure. It's not as pokey.
Hmm?
At first, and look at two, talking about sutures. I can bring your skull like a dishcloth right now.
Good. You're just moving all over the place.
Feel it? Isn't that wild?
Like a couple of cookies smashed together.
Oh, no, we don't eat cookies.
That neck is like jello. And also, whoop, whoop, whoop. See?
Oh, yeah.
The circles. See now, even with a big boy like you, who's nothing but muscles, look at how I can get in and do work. Because your brain's just going, hey, I'm just lying down. I can do whatever I want. Now, if you were standing up, you'd think these muscles would get it. That was pretty good, huh?
I say so.
See? So now just lie down again.
You just flip that inside out and
Yeah.
nobody's business.
See?
And that's just from working in the neck.
Oh yeah, like eyes. Eyes are crucial too.
Why the eyes?
Because again, if your eyes were fixed, okay, so stare at a spot on the ceiling.
Want me to turn the camera?
What? No.
Okay.
If you want, you can. Do you want more of a pan shot? Okay. So stare at us. So this is just relax then.
Okay.
So see how I can just, and that's your left leg.
Okay.
So stare at a spot in the ceiling.
Got it. Huh. Yeah.
Yeah. Okay, relax the eyes. Just pretend there's an itch on your nose. No difference?
Yeah.
So now, just think mad through the eyes. I can't even get the leg up. Let the eyes go. That was just think mad.
Right.
But also what's really cool with all of this now, I know I've done it before with you, but just because of what I do with the head, boom, boom, totally.
That was easy.
Yeah, but not only that, but once you got to the floor, it's like, yeah, and I'm up.